दोस्तों welcome to channel Toxicology and More. Today in this video we will be learning about another important DABT topic, that is methylene chloride, elevated carboxy hemoglobin levels. So let's directly dive into the question. This question is taken from ABT recertification examination May 2000. Okay, so let's see what is the question. The question is elevated carboxy hemoglobin levels occurs following exposure to. Okay, so these are different solvents in the option, so we need to identify the one of the solvent which is increasing the carboxy hemoglobin level. Okay, so the first option is bis chloromethyl ether. Option B is methylene chloride. Option C is methyl ethyl ketone. Option D is methylene blue. Option E is methyl chloride. Okay, see, if you look into all these four options, no, B, C, D, E, all appears to be nearby options only. Methylene chloride, methyl ethyl ketone. Okay, also read with respect to methyl ethyl ketone, no, dimethyl ethyl ketone. Such related questions will also come. Also read about methylene blue, its application. If methylene blue is used as a dye or it is used as a solvent, you go back and check yourself. Okay, so methyl chloride also, CH3Cl it might be. What are the other synonyms are there? Whether it has been listed under ICS Q3C, is it used as an industrial solvent? So all these points also you read. Okay, but today this video will be only with respect to methylene chloride only. The right answer will be in the green text, that is methylene chloride. Okay, but you read with respect to other four options also, their applications. Okay, and if they have any toxicology or adverse effects, any target organ toxicity, or if they have been listed under any kind of other hazardous list, whether it has been listed under NIOSH or OSHA, like that also you read. So in with respect to any question coming with respect to that content also, you will be able to address in the exam. So coming to the methylene chloride, this is the one which is increasing the carboxy hemoglobin level. Increasing the carboxy hemoglobin level, it is taking place. So let's see what it is exactly. So coming to this exposure to this methylene chloride, no, another synonym name for this methylene chloride is dichloromethane. So what is methane? Methane is nothing but CH4. So in the case of CH4, no, two hydrogen groups are replaced with the chlorine. Okay, that is, it is methylene chloride. So what it will do? It will cause us increased carboxy hemoglobin levels, because what is this? What it is doing? This methylene chloride, no, it will metabolize to carbon monoxide, and carbon monoxide is the one which is highly toxic, and it will go and bind with hemoglobin, and it forms a complex formation, that is carboxy hemoglobin. And important thing you have to learn is that if there is an hemoglobin and in your body you have carbon monoxide and you are having oxygen, then this hemoglobin will have more affinity, 200 times more affinity towards carbon monoxide than oxygen. Okay, because of which, no, you will no longer have free hemoglobin to which oxygen can bind. So the oxygen carrying capacity to the major organs will be decreased. Okay, because of which deprive of oxygen to the tissues, and cells will start forming under death. So let's read in detail. So that was about methylene chloride. It will metabolize into carbon monoxide, that too in the liver. Metabolism is taking place in the liver. This conversion is a major mechanism of this methylene chloride toxicity. In addition to, some of the methylene chloride by itself will also cause narcotic effects. That you have to remember in your mind. So if you look into this methylene chloride exposure, no, it is a serious occupational household hazard. Okay, there are the paint strippers are there. Those who are working on this paint strippers, no, if they are working in the closed area, and if there is no proper aeration or oxygenation is there in that closed area, the workers who are working with this methylene chloride or trained strippers, no, they will have this solvent toxicity will be there. Asphyxia, decrease of cardiac arrhythmia, such kind of effects, adverse effects you will come across. Aerosol products used in poorly ventilated air. There are a lot of, in if you see in US, a lot of incidents are there. Paint strippers incidents, accidental occupational hazards are there. If you have an opportunity, go through those videos and you can understand the serious issue with this particular thing. Awareness, its link to carbon monoxide poisoning is crucial for proper medical diagnosis and management. So I told you, no, if you look into this hemoglobin, no, it will carry both oxygen as well as carbon dioxide. Okay, Now what is happening? This is your hemoglobin and this is your RBC, this is your oxygen and this is your carbon dioxide. Coming to when you are exposed to this methylene chloride or carbon monoxide poisoning, here this is your purple color, you can see carbon monoxide. It will bind very tightly to your hemoglobin. This is your hemoglobin. Okay, to this hemoglobin your carbon monoxide is bound, very tightly it is bound. As a result, your oxygen and carbon dioxide can no longer be carried to the tissues. So this is how deprivation of this oxygen to the concerned tissues, particularly heart and brain, will be decreased. And your heart and brain are the one major organs or tissues in your body which need maximum supply of oxygen, pure oxygen. Okay, so let's see what are the important information that we can learn with respect to methylene chloride. Mechanism: methylene chloride is absorbed and is metabolized to carbon monoxide. Metabolization is taking place in the liver and it is metabolizing to this toxic metabolite toxic gas, that is carbon monoxide. Okay, so the primary exposure is through inhalation, but some part can be also through skin as well as ingestion. Okay, closed area, those who are working in paint strippers, no, their exposure is mainly through inhalation. This carbon monoxide, it will bind to the hemoglobin with an affinity of 200 times greater than oxygen. As I told you now, forming carboxy hemoglobin, reducing the blood's ability to carry oxygen to the vital tissues, particularly that is brain and heart. Coming to delayed peak, the key characteristic of this methylene chloride poisoning is that carboxy hemoglobin levels may not peak immediately. So even after exposed, after a couple of hours, still it will show some adverse effects also after 1 or 2 days also. That we'll see. The chemical is stored in the body tissues, especially in the fat. Adipose tissue में जाके it will go and store itself. Slowly released and metabolized over time, meaning carboxy hemoglobin levels can continue to rise several hours, sometimes peaking 5 to 6 hours later and remain elevated to 1 to 2 days after exposure. Coming to symptoms and severity, the symptoms which are caused by this increase in carboxy hemoglobin level in the blood is headache, dizziness, nausea, and it will also causes confusion, seizure, and coma. Important, most serious are these cardiac dysrhythmias as well as death in the case of fatality in the case of severe cases. Okay, so at every time point, you need to measure this carbon monoxide, carboxy hemoglobin levels in your blood every time point. Okay, so this is, as I told you, another synonym name is dichloromethane. If you look into methane or CH4, two of the hydrogens have been replaced with chlorine. That's why it is called dichloromethane or methylene chloride. So symptoms of poisoning are headache, upset stomach, vomiting, weakness, chest pain, and confusion. Metabolism, if you see, it is undergoing glutathione as well as acted upon by the CYP2E1 enzyme. This is the toxic gas which is formed carbon monoxide. Bind to hemoglobin, it forms carboxy hemoglobin. So along with this, you read page number 37, all this 1163, 1173, 1191, 1192, and 1156, which are mentioned about this carboxy methylene chloride in this Clayson 9th edition. Okay, I have listed out the pages. Please go back and read. And this is also taken, this particular proposed pathway for this methylene chloride metabolism is taken from page number 1550 of Clayson 9th edition. Okay, here you can see there are different pathways 1, 2, 3, 4. One is mixed function oxidase pathway, second one is glutathione transferase pathway, third one is the nucleotide pathway. Okay, here you can see, and okay, and important thing is that here carbon monoxide gas is formed and which will go and bind to hemoglobin and form carboxy hemoglobin. Okay, also I have seen that in table 31.6, no, they have given this particular methylene chloride, it is listed under 30 urban air toxic. So nowadays one of the topic you might come across in the exam is about pollution. So they might list out certain toxic so this is comes under dirty 30. So read this table also in the Clayson. Okay, then we will see what are how this carboxy hemoglobin is differing in case of smokers and non-smokers. Coming to non-smokers, no, normal carboxy hemoglobin levels are typically below 3%, whereas in the case of smokers, the baseline is up to 12%. So poisoning is generally considered at levels over 10%. So in the case of smokers, whenever it is more than 10%, then only you can consider. With severe poisoning associated with levels over 20 to 25% and severe symptoms. So how are you going to manage this particular type of poisoning is that an elevated carboxy hemoglobin levels, that is more than 2% in the case of non-smokers or more than 9% in the case of smokers, it will support diagnosis. How you are going to do is by using, as I told you, every time point you have to monitor this carboxy hemoglobin measurements for monitoring the conditions. Okay, and the treatment involves immediate action. One is, another is hyperbaric oxygen therapy. With respect to immediate action, no, patient has to be removed from that exposed area. You have to also remove the clothing because you do not want further absorption through the skin. Okay, and administered 100% oxygen, that is nothing but your hyperbaric oxygen, you will say, because oxygen will act as an antidote. Let's see why a non-breather mask or endotracheal tube. Here you have to do an oxygen act as an antagonist to the metabolically released carbon monoxide and helps to clear this carboxy hemoglobin from the blood. Okay, second one is a hyperbaric oxygen therapy used in severe cases to rapidly reduce this carboxy hemoglobin because of its half-life and improve tissue oxygen. We do not want the brain and heart to deprive from the oxygen. So in such a case, this hyperbaric oxygen therapy will be useful, but also it will still have some disadvantage when you go for hyperbaric oxygen. Probably some immune system will be compromised or some kind of adverse effects will be there. Please go back and read. In addition, I have also gone through Clays and Short book, page number 366. They have given some information about methylene chloride. Some of the points have already been covered in the previous slide. So you can pause here and read in detail. So in addition, I have come across page number 34, table number 34 2, where in page number 1556 and 1333 in the Clayson 9th edition, these 2 points have been included. So if you look into these occupational diseases and the toxicants that cause them, methylene chloride is listed under this table and it is causing cardiovascular disease, particularly it is causing arrhythmia as well. Okay, then if you look into this particular on page number 1333, it is this methylene chloride, it is been mentioned and it is been listed as a carcinogen by the NTP, IARC, California State of Safe Drinking Water, Toxic Environment Act 1986 and Prop 65. So along with this one, you also read what is NTP, what is IARC, what is Prop 65, this Toxic Enforcement Act 1986 in detail, Safe Drinking Water Act. So some questions with respect to regulatory agencies also you be, and it is a part of the DABT syllabus also. Okay, so that was about the methylene chloride. So whenever certain topic is there, please read wherever the topic comes in the textbook. Important, try to make it notes, because when an examiner asks the question, he will integrate. He will not ask an isolated question. He will integrate the topics related to to that particular agent or chemical, so that he try to confuse you. And so here you can see most of the options were very nearby. So read in detail. Okay, thank you so much. Be curious. For any questions, you can always write mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel Toxicology on Board. All the best for your exam.